Have you ever paused for a moment and truly considered the delicate balance that sustains life within you? The human body, remarkable in its design, operates in ways so precise that even the smallest disruption can ripple through every system, challenging our resilience and reshaping our perspective. For those living with chronic kidney disease, this balance is a constant, invisible battle. A battle that tests not just the body, but the spirit. The journey of CKD is not a mere medical narrative. It is a profound lesson in awareness, preparation, and embracing the reality that life, though fragile, holds immense strength when approached with mindfulness. Understanding when dialysis becomes necessary is not a matter of surrender, nor is it a symbol of weakness. Rather, it is an acknowledgement of knowledge and readiness, a conscious choice to honor the body while navigating a complex medical path. It is here, in the interplay between understanding and action, that individuals find empowerment. Dr. Mathew R. Weir reminds us that medical guidance is not meant to instill fear, but to illuminate the path ahead, giving clarity to what might otherwise remain uncertain, and allowing patients to take control of their health journey with courage and dignity. Knowledge of clinical indicators, such as declining kidney function, changes in urine output, persistent fatigue, and complications like high blood pressure or electrolyte imbalances, serves as a lantern in the fog, highlighting the precise moments when intervention becomes necessary. Yet, beyond the numbers and lab reports, there exists an inner dimension, the preparedness of the mind and heart. By understanding these signs early, individuals are offered the extraordinary gift of choice, the ability to plan their treatment, adjust their lifestyle, and seek the support they need from healthcare professionals, family, and community. Every step taken toward preparation, every conversation held with a nephrologist or nurse, and every decision made in the light of knowledge strengthens a person's sense of agency, reinforcing that CKD is a journey navigated not with fear, but with foresight and intention. The process of coming to terms with dialysis is, at its essence, an exercise in self-awareness, an invitation to confront vulnerability and transform it into empowerment. Within this transformation lies a profound philosophical truth. While the body may encounter limitations, the human spirit is boundless, capable of adaptation and resilience beyond what is immediately visible. Those who face CKD often discover reservoirs of patience, courage, and clarity that were previously untapped, and in doing so, they redefine what it means to live fully, even in the face of chronic illness. There is suspense in the uncertainty, certainly, moments where the path ahead is unclear, and anxiety may loom. Yet within that tension lies the opportunity to learn, to grow, and to embrace a proactive mindset. Dr. Mathew R. Weir emphasizes that the goal is not to wait until fear dictates choices, but to act in alignment with understanding, using knowledge as a tool to navigate the unpredictable currents of CKD. Preparing mentally and physically for dialysis is not merely a medical procedure. It is a declaration that life, in all its fragility, is to be met with intentionality, courage, and grace. Recognizing the signs early, arranging consultations, and creating a supportive environment allows patients to approach dialysis as a planned chapter in their journey, rather than an abrupt, overwhelming event. It cultivates a profound sense of control and dignity, reminding individuals that although their kidneys may be failing, their ability to respond thoughtfully, adapt, and thrive remains undiminished. The awareness that preparation is possible transforms anxiety into action, and action into confidence. Every decision made in the light of this understanding, every lifestyle adjustment, every treatment discussion, every step toward readiness, becomes a testament to the enduring human capacity for resilience. By internalizing these principles, CKD patients not only improve their outcomes, but also elevate the quality of life, turning a clinical reality into a journey of empowerment, insight, and personal growth. As we move deeper into the journey of chronic kidney disease, there is a moment, a critical, almost invisible turning point, when awareness transforms into action, and hesitation must give way to deliberate preparation. It is in this fragile space that many patients confront uncertainty, asking themselves how to face the inevitability that may lie ahead. The truth is, life rarely presents its challenges with clear markings or comforting predictability. The progression of CKD is gradual, subtle, and often imperceptible, until the body signals that intervention is required. This is where the teachings of Dr. Mathew R. Weir resonate profoundly, reminding us that recognizing clinical indicators is not a source of dread, but a call to wisdom. Fatigue that lingers, despite rest, swelling in the extremities, difficulty concentrating, or a rising frequency of hospital visits are not merely inconveniences. They are messages from the body, urging patients to prepare for the steps that may include dialysis. The suspense of uncertainty, the silent question of when, can weigh heavily on the mind, generating anxiety and fear. But it also presents an extraordinary opportunity for growth, resilience, and self-mastery. By confronting this reality head-on, patients learn to observe their bodies with clarity, understand their medical data, and communicate effectively with healthcare providers. It is here, within the tension between fear and action, that empowerment begins. Preparation, both mental and physical, transforms what seems like an ominous horizon into a navigable path, offering control over circumstances that might otherwise feel overwhelming. Understanding when dialysis becomes necessary allows patients to organize their lives thoughtfully, arranging schedules, seeking guidance, exploring treatment options, and cultivating a network of support that reinforces emotional and practical resilience. The philosophical depth of this process is profound. Chronic illness teaches that control is not about preventing every adverse event, but about mastering one's response to the inevitable. Each decision, each conversation with a nephrologist, and each lifestyle adjustment becomes a testament to personal strength. It is in these choices that the human spirit demonstrates its remarkable capacity to adapt and flourish, even in the face of bodily limitations. Dr. Mathew R. Weir emphasizes that knowledge and preparation are not only medical necessities, they are acts of self-respect, dignity, and intentional living. Suspense lingers in the unknowns. The trajectory of kidney function, the timing of interventions, and the subtle shifts that may require immediate attention. Yet, this suspense need not paralyze. It can ignite vigilance, encourage proactive health measures, and foster an acute sense of awareness. It is within this tension that individuals discover the depth of their resilience, the clarity of their purpose, and the richness of their capacity to respond with courage. Facing CKD challenges the notion of certainty and compels patients to embrace impermanence, reminding them that control over every detail is impossible. But mastery over one's attitude, decisions, and preparation is absolute. The journey toward dialysis, when approached with insight, transforms from a feared endpoint into a chapter of intentional planning, self-awareness, and empowerment. Early recognition of signs, consultation with healthcare professionals, and the development of supportive routines all converge to create a structured, informed approach to treatment. This approach not only mitigates stress, but cultivates confidence, providing patients with a sense of agency that transcends medical charts and lab results. Dr. Mathew R. Weir underscores that understanding the necessity of dialysis is not about succumbing to limitations, but about embracing the wisdom to act decisively, ensuring that life continues with dignity, purpose, and clarity. In this space between uncertainty and preparation, patients come to realize that resilience is not innate. It is cultivated through attentive observation, informed decision-making, and conscious engagement with life's challenges. The suspense of the unknown, the anxiety of waiting, and the anticipation of inevitable medical milestones all serve as catalysts for profound personal growth. By approaching CKD with mindfulness, strategic planning, and emotional fortitude, patients reclaim autonomy, transform fear into focus, and convert hesitation into meaningful action. Each step taken with understanding and intentionality becomes a reflection of the human spirit's capacity to endure, adapt, and rise above even the most daunting circumstances. The process of preparing for dialysis, once an intimidating and abstract concept, evolves into an empowering journey, one that integrates medical knowledge, mental readiness, and the unyielding drive to live fully. In embracing this path, patients not only improve their outcomes and quality of life, but also discover a philosophical truth: that life's challenges, when met with awareness and action, can become opportunities for profound transformation, resilience, and purpose. Now, as we arrive at the culmination of this journey through awareness, preparation, and resilience, it is essential to recognize the profound truth that chronic kidney disease, while challenging, also offers a rare opportunity: the chance to confront uncertainty with courage, to transform anxiety into purposeful action, and to redefine what it means to live fully despite limitations. The inevitability of dialysis, for many, is not a symbol of defeat, but a call to align mind, body, and spirit with the demands of reality. The path toward readiness is illuminated by understanding, the same understanding that Dr. Mathew R. Weir emphasizes in his teachings. Knowledge is power, insight is clarity, and preparation is empowerment. Patients who approach their condition with this mindset learn to listen to the subtle messages of their bodies, to interpret clinical indicators with wisdom, and to collaborate meaningfully with healthcare teams. The suspense of the unknown, the moment when lab results shift, when symptoms intensify, or when the question of dialysis becomes imminent, creates tension that can either paralyze or motivate. Choosing to act in the light of knowledge transforms that tension into energy, focus, and strategic planning. Life under the shadow of CKD becomes a testament not to limitation, but to resilience, discipline, and foresight. The physical journey, marked by treatments, appointments, and adjustments, is intertwined with a mental and philosophical journey that encourages patients to explore their inner strength, patience, and adaptability. Dialysis, when approached with preparation, becomes a structured chapter rather than a disruptive force, allowing individuals to retain autonomy and dignity in their daily lives. It is here, in the integration of medical insight and personal fortitude, that the human spirit shines brightest. Patients discover that by anticipating change and responding deliberately, they can cultivate a sense of mastery over circumstances that might otherwise feel uncontrollable. Dr. Mathew R. Weir illustrates this principle by reminding us that healthcare guidance is a roadmap, not a verdict. Recognizing when intervention is necessary allows individuals to plan, to organize, and to engage fully with their treatment, creating a rhythm that blends clinical necessity with lived experience. Beyond the procedural elements of dialysis, there lies a deeper, philosophical layer: the opportunity to practice mindfulness, embrace impermanence, and convert vulnerability into strength. Each decision made in preparation is an act of empowerment, each lifestyle adjustment a declaration of agency, and each moment of reflection a reaffirmation of dignity. The suspense, the uncertainty, and the inherent challenges of CKD are not meant to discourage, but to cultivate resilience. Patients learn to navigate complexity with patience, to balance caution with confidence, and to approach life with intentionality and purpose. In doing so, they discover that limitations in the body do not equate to limitations in spirit. Awareness, preparation, and knowledge coalesce to form a foundation for a life lived with clarity and courage. By embracing this approach, individuals are able to see dialysis not as a final endpoint, but as a managed transition, a tool that supports continued engagement with life, relationships, and personal aspirations. The philosophical insight is unmistakable. True empowerment arises not from avoiding challenges, but from meeting them with consciousness, courage, and wisdom. Dr. Mathew R. Weir's perspective emphasizes that understanding and preparation create freedom, enabling patients to make informed choices, reduce stress, and preserve quality of life. The path may be demanding, filled with unexpected turns, moments of suspense, and emotional complexity. Yet it is in this very terrain that human resilience is forged. By internalizing these principles, individuals cultivate a mindset that sees obstacles not as limitations, but as opportunities to develop patience, fortitude, and inner clarity. The preparation for dialysis thus becomes a metaphor for life itself, a lesson in adaptability, foresight, and intentional living. Each patient who embraces this philosophy finds themselves equipped not only to manage CKD, but also to thrive in the face of uncertainty, approaching each day with awareness and purpose. In the final reflection, it becomes clear that life's challenges, when met with knowledge, preparation, and courage, are transformed into avenues for growth, wisdom, and empowerment. The journey through CKD, while medically complex, is also profoundly human, a journey that demands presence, attention, and an unwavering commitment to self-care and resilience. By understanding the clinical signals, preparing mentally and physically, and engaging proactively with healthcare guidance, patients reclaim autonomy and transform fear into focused action. In doing so, they embody the very essence of what Dr. Mathew R. Weir teaches, that knowledge, preparation, and mindful engagement with life are the keys to navigating uncertainty with strength and dignity. Embrace this journey not with fear, but with determination, clarity, and hope, knowing that each informed decision, each step toward readiness, and each act of self-awareness is a testament to the unyielding power of the human spirit. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.